Hang on. Okay, much has happened. Much has happened in 2 weeks. I have had a very bizarre couple weeks. And we get to talk about that. Yeah, you might notice that the title of the stream is a little strange. Yeah, that's... Those things happen. Those things happen to me. Oh, man. So that happened. I have not been on because my 9-month-old daughter is absolutely kicking the living shit out of me right now. I hoped we were, you know, kind of through the whole sleep problems thing, but hey, then teeth came around to fuck that right up. Oh my goodness. Yeah, teething. It is not my friend. Not my friend at all. She's got those little chompers poking through. So, I say that like, poor me, but my wife's still nursing, so, somehow I think that might come out a little worse for her than it does for me, because she's up anyway, and she gets chewed on. So, yeah. I don't envy her that. In other news, Path of Exile has been very kind to me. You guys have missed like an entire character of mine, which was one that I specifically made to take advantage of the league mechanic with, and little beknownst to me, I basically made the meta character for this league on my own. I just kind of randomly came up with it because I heard I didn't really get into this league for about a week, and I heard that, you know, like knockback and kind of like crowd control stuff was really good for the mechanic, and I was like, well shit, why don't I double down on that? And I did, and apparently everybody else did too, in the exact same way. I guess my build's a little bit different than the sort of prevailing cookie cutter one, but it's damn close, which is both cool that I sort of like unlocked the secret, and also frustrating that I'm like, I have this really cool build that everybody else also has. Oh well. It works though. So here, if you know anything about Path of Exile, this will blow your mind. What? 122 divine orbs. This is literally in 1500 chaos. This is far more currency than I have ever had at one time. This is probably, like, almost certainly more currency than I have ever generated in, what, like 3 years of playing Path of Exile total. So this is, yeah, I have an embarrassment of riches right now. So that other build worked really well. Yeah, so the title of the stream is about weird shit that happened in OB, basically, but we've also had a weird, just sort of strange, like lots of just odd things happening in the operating room and like at work. So it's sort of a shame that I haven't been able to keep you guys up with that, but man, I've just been exhausted. Definitely do not have the energy to, stay up till 10 o'clock, much less speak the whole time and play games and entertain people. So that wasn't happening. In other news, have you guys seen the Nick Chubb injury? If you don't know who Nick Chubb is, other than a dude with a funny name, he is a really good running back for the Cleveland Browns, and his career is probably now over thanks to the injury that he had on Monday night. It was one of those, like, Joe Theismann-like injuries that was too gruesome for them to re-air. Like, they had a very clear view of it on live TV, and then the producers were like, ooh, 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 yeah, get rid of that. Don't do that. Do not show that anymore. Yeah, basically, he, like, bent his leg backwards and just annihilated his knee. I would be extremely surprised if he ever plays football professionally again. It's certainly not on a high level. I mean, I guess I'm not an orthopedic surgeon, but man, that shit looked terrible. And we'll watch that. We will 100% watch that on stream. I might get banned on Twitch for that. I don't know. It's pretty gruesome, but it's not like explicit or anything, I don't feel like. But it's educational. We'll talk about knee injuries. We'll frame it as a medical educational experience. Oh my goodness. Oh, I've made the very common error of not having Discord up. So if you guys are talking to me, oh, you weren't. Okay. I hate you too. Anyway, yeah, so good times. It has been a wild ride. I feel like this is not... Yeah, this is Thievery Corporation. Why is this... I was like, man, this sure doesn't sound like... Alright, well, the first part of this stream is getting copyright dinged. Bummer. Let's see. Let's go back. This was... No, damn it. Play the song. There we go. I was like, this doesn't sound like cheap knockoff synthwave music. This sounds well produced and like something I would actually listen to. Oh, that's because it is. So if you enjoyed that, the stylings of Thievery Corporation just then, I recommend you checking out that album. That's Sodad. That's a really good album, in my opinion. One of these days, I will figure out how to multi-stream, but also remove the soundtracks from platforms that are not Twitch. I can do it if I just only stream to Twitch, no problem. And this is sort of a complicated matter, but if you stream like to multiple platforms, you can't do the same thing. You have to stream only to Twitch, and I think that's a foolish thing to do because YouTube is just better for everyone. It's much easier to, you know, access information and stuff. So anyway, the first thing on the list is it opens a whole can of worms, which is kind of why I want to talk about it. So we had a patient in OB who had hemophilia. Now, if that doesn't strike you immediately as really weird, it should. It's because hemophilia is an X-linked disorder. What is an X-linked disorder, you may ask? I know a lot of you are in, you know, med school or residence or something, and so this is, you know, sort of extra information that you already have. But for those of you who are not medically inclined, we'll go through it. So what is an X-linked disorder? So you have 23 sets of chromosomes, right? So men have XY chromosomes and women have 2X chromosomes. So most like genetic disorders are recessive. That's not universally true, but like, hey, so what's up, man? How are you? Long time no see. How's life? We're talking about hemophilia. So yeah, so X-linked traits are on the X chromosome, as you may surmise. So I feel like most people have had, you know, high school biology and sort of know about dominant and recessive traits, so I'm not going to go into that too much. But what may come to light here is that starting clinicals? Oh, cool. Do an airway workshop. Oh, how'd you like it? Yeah, it's tough to get an exposure to anesthesia, even if you want to. It's just not something that people see very often. But yeah, so if you have an X-linked recessive trait and you're a man, you don't have anything to like mask that trait, right? Because you have a Y chromosome. So that's why men are more often colorblind, they're more often hemophiliacs. I'm sure there's, you know, other common X-linked traits that I'm just not thinking of. But those are way, way, way more common in men. So for a woman to be a hemophiliac, she has to have hemophilia on both of her genes, or on both of her chromosomes. So that's why that is very rare. You had one 2 weeks ago too, but you felt much better. Yeah, I mean, anesthesia is definitely a repetition sport, right? Practice makes perfect. The resident went off the deep end about how good the lifestyle was, huh? So, yeah, it is a good lifestyle. I'll give you get 1 week with anesthesia. That's a bummer. Yeah, we got 1 week with anesthesia too. But I made it known during my surgical rotation that I was interested in anesthesia. And so they, every surgeon that I worked with was like really, really understanding and like accommodating of that. Because they were like, hey, if you're going to do surgery, you need to understand anesthesia to some degree. Which I thought was a very progressive, attitude. I mean, it's true, but, I feel like a lot of surgeons are kind of like surgery first, or stereotypically at least. You can request a second week? You should. I feel like anesthesia, I mean, obviously this is a, biased take, but like a lot of things in anesthesia are like really important and applicable to other stuff, especially in the basics. Like if you can place an LMA in somebody or mask ventilate someone or place an IV, that's super useful to you regardless of what specialty you choose, with the possible exception of like psychiatry. But those are just like handy skills to have. Like it's pretty likely that at some point in your career you'll have somebody like pass out in your office or whatever. And if you can mask them and put an IV in them and like start resuscitation, great. You probably just saved that person's life. But yeah, anesthesia lifestyle, it is hit or miss. Right now it's amazing because the market is so hot. Kind of want PMR. PM&R is really good. That's a underrated specialty, in my opinion. The lifestyle there is great. Yeah, lifestyle for PM&R is very good. Low acuity most of the time. Easy hours, predictable hours. No, pay is on the low end, which is probably why it's not super popular. Yeah, anesthesia pay is skyrocketing right now. And quality of life is as well. You have to, you kind of have to have all the things to have an attractive job in anesthesia at the moment. Like, there are locums jobs around me paying $450 an hour. And granted, that's in the middle of freaking nowhere, but it's a lot of money. It's a lot of money. And I know, like, my job in particular, I think we probably have one of the better lifestyles in town, but we're clocking in about high 30s hour weeks, including call. And our call is actually, like, getting a little bit more difficult than it has been historically, but it's still not bad. Anyway, so hemophilia. So we get called, one of my partners gets called to put an epidural in this woman. And the nurse basically just reads off this, like, list of stuff that doesn't really matter about the patient and leaves off the fact that she's a hemophiliac. Which is problematic for a lot of reasons, not the least of which is that it's pretty dangerous to put an epidural in a hemophiliac because there are lots of blood vessels around your epidural space. So if you hit one of those vessels and it bleeds, you can have something called an epidural hematoma. And that can push on your spinal cord and paralyze you, potentially. So that can be a neurosurgical emergency. So she basically predisposed us to doing that. But fortunately, my partner is not an idiot and actually went and interviewed the patient himself and didn't just take the nurse's word for it, which you should always do. And discovered that she did, in fact, have hemophilia. And she was fortunately very educated about her condition. So it wasn't like, huge problem, really, because he caught it beforehand. But then he was like, we're not going to put an epidural in this person because that's stupid. Cockroach Princess, what's up? It's so good to be back. I'm glad you were here. Glad you're here. But yeah, so basically they kind of potentially threw us under the bus. And whether or not that was intentional is sort of up for debate, and we'll talk about that in a second. How were the cockroaches? But, yeah, so this lady apparently had delivered previously with an epidural, and I don't know how she found somebody to place one for her, because that was like, my partner came down and was like, she told him this story, and, he told her, 90% no, and he came and talked with us, and he's like, dude, would you guys do this? Like, am I just being a pussy? What's the prevailing wisdom now? And I was like, hell no, I wouldn't touch that with your dick. So, state of euphoria now that somebody give you a reason to get off Tinder? Was it me? Did I give you a reason to get off Tinder? I'm so sorry that I relegated you to to 2 weeks of swiping different directions. There are so many reasons to get off Tinder. It's true. It's so true. Where the hell am I going? I got the sun orb. Where's the way out of here? Is it down there? Jesus, what the fuck is this layout? Oh, talking to a dude, yeah! Rock on. Tell him your super cool Dr. Nerd Gamer friend approves. Ah, here we are. No, it's not there. What the fuck? I'm so confused right now. Is it all the way back here? I don't think I've ever seen this layout before. Oh my god. Oh, I'm tripping out, man. I'm freaking out. Where the fuck is the exit? Where's the exit? Oh, this is level 2. Oh shit, I'm an idiot. No wonder. Okay. Damn it. It's on level 1. Yeah, so hemophilia. Back to that. Yeah, so, like, there's this back and forth, you know, where the patient's like, well, I've had this before. And we're like, no chance in hell. No way are we placing this epidural. Because, like, the downside is, you know, you paralyze somebody. I mean, so epidurals are pretty benign. And I think the prevailing thought in most OB departments is that they're like a right of patients to have, especially the nurses. They're just like, oh, well, this patient deserves an epidural, and they don't think of it as like a procedure that you have to weigh risks and benefits for. And so, you know, the nurses were upset, the patients are upset because, you know, the nurses are advocating that they get an epidural and all that sort of stuff. So, you know, we look like the bad guys, of course, even though we're like trying to prevent this woman from having this catastrophic consequence. And it's not like he just said, no, I can't do anything for you. He's like, you can have narcotics, you can have this, like, you know, PCA, we call it a PCA, it's patient-controlled anesthesia. It's basically like a button that you press that gives you, like, small doses of narcs. So, like, we can work with you, but we're just not sticking anything in your back. And then, so, she refused to push because she didn't have an epidural, and then she had to get a C-section. We're like, damn it. So it, like, went from bad to worse. So, like, we had to put her to sleep, and she fortunately had her own recombinant factor 8 around. And so we just, like, gave that, you know, right before the C-section, and I think that worked out fine, apparently. So, all is well that ends well, I suppose. But we were sort of set up for failure. Why can you not just push? You can just push. She just didn't want to. Going to OB. Well, it's, I don't want to color your experience. But I hope you have a good time, and I hope you enjoy it. I'll just say that. How do you refuse to push? Yeah, it kind of does. Your body does sort of make you do that. Yeah, there's definitely that positive feedback loop that gets pretty tough to resist. So, I'm not entirely sure how you go about refusing to push, but apparently that's possible, because some people do it. You have a weird clinical curriculum, so you went to work with psych, but it was at a correctional facility. Okay. Well, that seems like the type of people that you want to be working with. That's in the deep end for sure, getting thrown in. But yeah, so let's talk about the teaching points here with this hemophilia case. So, the first and most troubling thing in my mind is that nobody reported that this patient had hemophilia. Nobody told us that. That should be the first thing out of anyone's mouth. And honestly, like, I feel like the OBs should have contacted us. They should have said, hey, this patient has hemophilia, and they're, you know, gonna be delivering around this time. And we have a pre-op clinic for exactly such situations. And we're having a meeting about this tomorrow, so I will get to voice my concerns. You're banning the word hemophilia. I refuse. I am banning your ban. I veto that ban. These are good rewards. They're just very half-assed rewards. Oh man. So yeah, so the fact that nobody like saw this and was like, hey, this really needs a second look, you know, from everybody who's going to be involved with this patient care. Can I teach you? You cannot have your 2K points back. You spin it. You break it, you buy it, bitch. And you probably have like 50 trillion points at this point anyway. You bought so many copies of Path of Exile. Which I owe you, by the way. I need to link that to you like 15 times. But yeah, the take home there is like, communicate with the people you're going to be working with, regardless of what specialty you choose. It's really important to just, you know, kind of, like, you don't have to, you know, I don't expect the obstetricians to like know the ins and outs of placing an epidural with hemophilia, but, you know, if they're like, bleeding disorder bad. Wait till anesthesia about bad thing. Anesthesia be happy. Like, that's what I expect. I don't expect them to, like, have a conversation with the patient about, you know, this and that. Like, just call us. Just call us. You know, if it's something, like, weird that you don't see all the time, just let somebody know. You know, if you're not familiar with a disease, like, call somebody who does do that all the time. Like, you know, they could have called a hematologist, which, to be fair, she had seen her hematologist, and the hematologist was like, yeah, you know, should be fine for an epidural. And, you know, but they're not the one doing the procedure. So it doesn't really mean a whole lot. That is one fairly frustrating thing when you're like a proceduralist and some other specialty who's not going to be involved is like, oh yeah, you can totally do this procedure, it's going to be fine. Like, okay, well, you don't have to deal with the fallout from that, so why are you making an opinion on this? Some people stockpile their SSRIs and snort them all at once. That doesn't seem like a great plan. It seems like a really good way to give yourself serotonin syndrome. Yeah, I'm not... What the fuck? Replying to Aiden Ross, he announced... What is that shit? Oh, it's just spam from Kick. Cool. Is this kind of random communication normal? When you have a really complicated patient, yes, it is. Yeah, it's sort of like a pleasant surprise, to be honest. Like, if somebody calls me and, you know, they're like, hey, I have this patient and I really want to talk about this. And I'm like, all ears. You know, even if the answer is, we don't need to do anything, it's no big deal. Like, it's very pleasant when somebody does that. You know, because at the very least you have a heads up. And they might be off base. You know, they might be totally off base. Like, what they're telling you is, you know, either useless or not a problem, or they're telling you the wrong things, but at least that patient's on your radar, right? That's kind of my point, is, like, at the very least, alert somebody that this, like, potential grenade is heading their way. You know, like, the instance that I'm thinking of is I had an orthopod put on these 3 cases. This was, like, one of my worst calls I've ever had, but he had 3 people all with critical aortic stenosis, which is, like, crazy dangerous with anesthesia. And probably won't have time to get into that tonight, but maybe we'll talk about it. But you know, he was telling me that there was like the one with the smallest valve basically was the sickest one, and it, you know, to his credit, she was very sick. But there was another patient who had like the critical aortic stenosis and like multiple heart arrhythmias, and was like, you know, there were some other things going on that I was like, wow, she is a bad candidate for surgery. But she had a hip fracture, so, you know, basically if I said no, like, she's gonna die. You know, she was like 90 something and was gonna die from her hip fracture, basically. So, you know, he was right to alert me and say, hey, I have these patients who might be problems. Even though, you know, his assessment of them as it pertained to me was not like 100%, at least he came to me and like recognized that these people were a potential issue. So yes, that sort of communication is normal, and I wish it was more frequent, honestly. I wish it was more frequent. And I think like maybe it's different in different places, but I feel like any like doc to doc communication is great. Like there are plenty of times when we get just somebody puts in an order for a central line, for example, and they say, you know, you get a call from a nurse that says, hey, this doctor wants you to do a central line. And, you know, so then you have to be like, why? Like, why do I need to be doing that? I don't understand. And, you know, then the nurse is like, well, I don't know. And they'll just kind of like list off a bunch of things that are wrong with the patient. You have to go look them up anyway. And it just is a huge pain in the ass. But, like if there's a guy, I live pretty far from our hospital, and so I choose to stay in-house for our call. And a lot of people at this point know that, which is fine. And they do kind of take advantage of that, but not frequently enough for it to really be a big deal. But in any event, there's a guy who actually lives a little bit farther away from me, from the hospital than I do. And he's a cardiologist, and he just called me on my cell phone in like the middle of the night. He's like, it was snowy out, like real shitty weather. He's like, hey, my patient really needs a central line. Do you mind going and placing it? And, you know, that's not my favorite call to get, but I was like, yeah, man, I got you. Like, I get it. Don't drive, you know, don't make what's like normally a 35-minute drive and would be more like an hour in those conditions. Like, don't do that. It's not safe. Like, I will go to the ICU and figure this out. It's not that big of a deal. Like, thank you for calling me, and instead of just like putting in an order and having some nurse like flag me down. You heard we're talking about OB? We are. So we're in the middle of talking about a case where, long story short, there's a patient with hemophilia, which is really weird. Because again, it's an X-linked trait, and that's like super rare. I was trying to figure out what the, yeah, hi, by the way, welcome. Long time no see. I feel like I haven't seen any of you guys in so long, because I haven't even streamed in 2 weeks, man. My daughter is just killing me. But yeah, I was trying to figure out what the incidence of hemophilia is in women, and it's low. Like the prevalence, there's like, the best number that I got was like around 3,000 women in the US. So like 1 in 100,000 people, 1 in 100,000 women has hemophilia, which is like 0. Incomplete. Yeah, a lot of women do have incomplete expression. They have like, they're carriers, and they have like some symptoms from it, but not like the full-on disease. This one had the full-on disease. I've forgotten what is that like. Is that incomplete dominance, or like, I can't remember my genetics very well. Incomplete penetrance. There you go. That's the one I'm looking for. The penetration. It's not all there. What is hemophilia? Do you even med school, bro? Come on. Yeah, they're short, or in her case, she's hemophilia A, so she's short on factor VIII. But yeah, we were talking about how this, like, somebody somewhere placed an epidural for this woman, and I do not know why, because I would never ever do that, regardless of how well controlled somebody with hemophilia was. You hate memorizing genes and associated diseases. Yeah, me too. That's like your hemonc unit in a nutshell. Is all these like weird ass mutations that cause cancer. I'm pretty happy to never have to know that again, ever. So yeah, this was leading us to a, you know, be able to like recognize big bad and ugly. Like, I'm not a radiologist, right? But I can look at a scan and be like, oh man, that's fucked up. You know, I miss like nuanced things most likely, but you know, if somebody's got like a giant midline shift in their brain, or there's a bone that's just like catastrophically wrecked, like I can see that, you know, and that's what I'm looking for, and what you guys should be aware of, like as practicing physicians. You know that like, oh, that sounds fucking bad. Maybe I should call somebody about this. Like, this person's gonna be taking care of that. Let me give them a heads up. Half of medicine is 3 letters. Dude, that's so true. So many gyms to level up. So many gyms to level up. What level am I? 60. Cool. And so the next interesting thing was we had a dwarf who had both of her legs amputated because of congenital anomalies. So to be clear, where the perspective I'm coming from is, our hospital is like kind of a, you know, medium-ish community hospital, like on the edge of the metro area. So at least on paper, we don't do high-risk OB, unless they just kind of like walk through the door. So that's the hospital's stance. Like, we're not prepared to manage these high-level cases. So the hemophilia case and this dwarf should have gone somewhere else, basically. So anyway, this like, and that got sprung on us as well. Like, one of my partners just kind of like went up there and was like, huh, this is not what I expected. So with dwarfism, you have a lot of, you know, musculoskeletal problems, like with your back in particular. So, you know, a lot of those people have had back surgeries with hardware put in, and, you know, some of them just have weird, like, scoliosis and arthritis and all sorts of shit going on. So that it could potentially make putting a spinal in for a C-section, which he was having a scheduled C-section, which is good, because you don't want that person to come in and spontaneous labor in a kind of potentially uncontrolled situation. Anyway, that makes... We call it neuraxial anesthesia, so like epidural, spinals, all that stuff. Anything that goes in your back falls in that category. So that makes neuraxial anesthesia potentially pretty difficult. Fortunately, it worked out really well. She did great. The spinal was easy, and, you know, everybody moved on with their lives. But as I mentioned, if either of those patients had been to our pre-op testing, we would have recommended that they get transferred somewhere else because they're high-risk patients. So that leads the question, Spirit of AT still awakens. Yeah, if only we could have adjusted this dwarf, she would have been fine. We would have cured her dwarfism, no problem. Action required, reconnect my Facebook account. I do not think I will do that, Restream. Thank you for letting me know, though. Yeah, so you... To me, these things are kind of obvious, right? Like, you look at somebody who's a dwarf with no legs, and you're like, maybe that might be a problem. Or you see somebody with hemophilia who has had a history of massive postpartum hemorrhage, by the way, and you think, that might be a problem. So, given that the people who are working with these patients are, you know, presumably pretty intelligent, like they've completed med school and been practicing medicine for a while, it makes you wonder if there's like some ulterior motivation, right? Like, that at least crosses your mind, where you're like, you know, they presumably know that these patients are going to get shipped out, right? And so, is that why they didn't send them to pre-surgical testing? you know, you never know. You don't want to think that. You don't want to think it's about like patient volume and, you know, ramming these people through to raise your numbers and get paid. But that's got to at least like cross your mind, right? Because these both of those seem like pretty obvious calls to me. Do they want to be called dwarves? Yes, this person was technically a dwarf. Like their condition is dwarfism, and I don't know about the etiquette on that, but like I think little people is the like accepted sort of like collective term for people of short stature, like pathologically short stature. But I mean, y'all didn't come here for political correctness, and you will not get it. I will try my best to not be like overtly, blatantly offensive, but you know, it is what it is. But yeah, those are things that, you know, again, it's good to sort of be aware of the world around you and what other specialties do and think about certain things. And I mean, we've gone as far as like literally listing out the things that we want sent to the pre-surgical testing area, and that's on there, like, you know, musculoskeletal malformations, which dwarfism counts as, cardiovascular conditions, hematologic conditions, all that stuff. And they're just kind of like, you know, we're just not going to do that. We're just not going to send those patients to you. Like, okay, guys. Okay. 600 milligrams of caffeine. So a cup of coffee, like a 8-ounce cup of coffee is 200-ish, right? I'm not a caffeine expert here. I need that open, actually, and I probably want that open, too. Boop. Boop. You don't get to see my 2024 schedules. Cup coffee. Let's do this. 95 milligrams. I was way off. Okay. So I guess 16 ounces, 200. That's what I'm looking for. Hey, Matt. What's up, dude? So this is like 400 milligrams is like 32 ounces of coffee then. That's a shitload of coffee, dude. So I mean, it doesn't sound like it's unsafe, but I probably wouldn't be doing that on the reg if I were you. What is a Celsius? Is that an energy drink with loads of caffeine? Ah. Yeah, I'm not like energy drinks. Standard cans have 200. Okay. Yeah, I mean that seems like quite a bit, dude. maybe you ought to just like sleep more or something if you're needing that much caffeine. Call me crazy. Charge your caffeine intake in winter quarter. You consumed 400 per day on average. All right, solid effort, sir. Solid effort. Peaked at 800 in a day. That's a fucking lot of caffeine. So that's what, 64 ounces of coffee? This is a lot, dude. I mean, study and be like that, though. I get it. Sometimes you just gotta power through. Yeah, I can't do that. Like, I would say I drink, like, half a cup of coffee a day, you know, that I'm off, which is actually a lot of days, believe it or not. I've back to that lifestyle thing. I have a lot of, like, days off, because we only do 16-hour calls now, which is fucking awesome, by the way. So I'm here in the morning probably more often than not, honestly. And, like, I'll have half a cup of coffee just because I like the taste. But I've got to limit it to that or else I get, like, fucking jittery, and when I come down, I'm a real asshole, so... I gotta be careful of that. Oh my god, this is so bad. Just being chased around by these dickheads. Alright. Stand and deliver, baby. Just spam the damage. 76 milligrams of Ritalin. Yeah, that would be an appropriate caffeine replacement, I suppose. just just protocolize your stimulant. No problem. $40 milligrams Adderall XR and 20 IR. Jesus, dude. How do you sleep? How do you guys ever freaking sleep? It sounds so bad. Psych put you on 40 milligrams of Ritalin, man. Or of Adderall, yeah, that's a lot, dude. Like, I'll be honest with you. I feel like Adderall is basically one of my least favorite drugs. It's one of the most overprescribed, shitty medications out there. It's great for people who like need it and it works for. But so many people have these like kind of like borderline quackish diagnoses of ADHD and just pound that shit. I know several people who take it basically for weight loss, which again is a terrible freaking idea. It's right up there with Xanax. Probably Adderall and Xanax are my two least favorite medications. You lost a ton of weight. Well, good. It's a nice side effect. I mean, I know you have ADHD, so you probably, you know, it's legit, but jeez, I'm getting my ass kicked. You okay, relatively? We are not okay. If you ate like 4,000 milligrams, you probably have an arrhythmia, dude. Caffeine is a pro-arrhythmic, actually. Ah, I'm dying so much. Wow. Why does that kill me so fast? I have decent cold res. Huh. I guess all those little things just stack up and F me in the A. Fun. There we go. Yeah, if you ate that much caffeine, that would probably be really bad. Palpitations after 100 milligrams of Adderall? Yeah. Yeah, especially if you're not tolerant to it. That sounds like a terrible plan. Dear God. I just want to see what this is like. Oh, it's terrible. That is great. So glad I did this. I found them. I want that jewel. Give it to me. Oh, didn't ID it. I feel like that's pretty good, actually. Okay. Accept. Boop. Had a sports med attendant give a lecture on concussion testing. Using a lot of stimulants mimics positive concussion testing? Really? That's interesting. Like with like nystagmus or something? I don't think I've ever heard that. Let's see. Do I have any quests that are unfinished here? Okay, gotta do that. Aiding an archivist. Oh, I gotta do my lab too. I'll get that taken care of here in just a minute. Okay, sell that. Yeah, it's kind of weird, like, how much drugs mess with physical exam findings. There's a lot of stuff like that. I mean, basically any, like, benzo or anything, you can't get a good neuro exam on somebody. So yeah, I have a, I think I mentioned this. We have a meeting with the, I've forgotten what it's called. It's like the perinatal committee or something. Basically, it's just a meeting with like hospital administration and the two OB groups, and we get to talk about all the things that should be changed but will never be, because it's just a committee to make more meetings. But at least I can go, and I'm somehow find myself the one who is like our representative, our group's representative there. So I get to go and show up and be like, yeah, we're not doing these things that really should be done. And then everybody's like, oh, okay. Well, sure, we're doing those things. Like somebody, that's the response I've gotten several times. Like, oh no, we're doing those things. Like, no, you're not. No, you're not. I just told you that those things aren't happening. Like, oh well, we'll educate our nurses. Okay, great. Which patients you thought got illicit substances was causing psychosis? Yeah, it's tough when like the really bad psych patients come in, because a lot of illicit drug use and like mental illness are basically, they go hand in hand, right? They're chocolate and peanut butter. So sometimes you have to like get somebody sober before you can really figure out what's going on. Found a bag of cocaine in a search. He's like, here's this cocaine. Do you think this has anything to do with why my patient's being fucking crazy? Like, well, yes, I do. Dude, vaginas are just nature's pocket. I don't see anything wrong with that. You weaned yourself off SSRIs without ever talking to your psych. I mean, that's actually surprisingly easy to do most of the time. A lot of SSRIs are, super long lasting, so tapering them is not really that hard. Like, in fact, so I've forgotten which ones, but some of them you can just stop cold turkey because their half-life is so long that it just like tapers. It's like a self-taper. Psychiatrist I am not, however, so please do not try this at home. Vaginas are nature's pocket. You should say that. I think that'll get you an instant pass. Tried cold turkey, would not recommend. Yeah, I don't think that's a great plan. It's only like select ones. I don't remember which ones they are. But what about honors? Ooh, I don't know about honors. I don't know about honors. But it'll at least get you like some street cred. You probably have to say something much more crass and offensive to truly get honors, though. What should I say to get honors? You should probably ask them which of the obstetric surgeries are their favorites. We had a... This is a joke that one of the old urologists loved to tell. He said that obstetricians have 5 surgeries. So they have a hysterectomy, a C-section, cut the right ureter, cut the left ureter, damage the bladder. Those are their five surgeries they do. I think you should break that out. They would appreciate that. That's honors for sure. Instant honors. What is this dude doing? What the fuck? What is that? Oh, that's just one of those guys. It looked like a totally different monster. Oh, good. I died right before leveling up. That's perfect. That's exactly how I wanted that to go. Your ortho attending thought it was too dark when you said there was less pressure in neurosurgery because the patients are usually pretty sick. I mean, they are. Most people don't casually have neurosurgery. Oddly enough. I guess maybe the exception would be like a hand specialist if they're doing like carpal tunnels for some reason, or spine surgery. I don't know. He's a hand surgeon. Well, how did I know? It's sort of my job to know these things, remember? Like, because I do this professionally. I know a little bit about surgery. It may not seem that way by listening to me talk, but Yeah, believe it or not, I do pay attention to what I do most of the time. Let's imagine this. Let's hallucinate this. That's awesome. That sounds like something I would say for sure. I feel like I'm kind of verging on that, like, weird preceptor. So we have anesthesia assistant students at our hospital, and it's kind of awesome because we sort of take the ones that are, like, our job is really desirable. So we just sort of handpick the ones that we want to get, and that is badass. It makes life really good for me because these are the people, like, on the front lines that I rely on to, like, not kill patients. So yeah, picking and choosing the people we want is nice. How does being a hand surgeon relate to thinking neurosurgery has too much pressure? I don't know. That's a good question. You missed this? Well, you didn't miss everything. You were just in time, in fact. Step 1 question generator. Which is a great name. Alright, let's get freaking nuked by these bosses. Dude, being a hand surgeon is awesome. That's a really good job. There are lots and lots and lots of people who want carpal tunnel surgery. So if you're like a fast hand surgeon, you can make a freaking shitload of money. And also make a pretty big difference in people's lives. Like, that's a, you know, that's a pretty big, like, quality of life problem when you've got median nerve entrapment. That said, you're going to be spamming the same surgery all day, every day. So, you know, if you don't want to do that, maybe avoid that. A breathing skills clinic? Yeah, so being able to bag mask somebody is... We actually kind of touched on this earlier. I feel like bag masking somebody is a skill that every med student should learn. And yeah, it's sort of an anesthesia pick, but I don't think that that's unreasonable, honestly. Like, that's ultra basic, and you will probably save somebody's life in your career with it. So bag masking somebody is good. Being able to place an LMA is really useful too. That's a good emergency airway. I would say, like, recognizing you know, like, respiratory distress. So like stridor, or like croup or stuff like that. The difference between stridor and croup, and what other good things, like more general things, be? Yeah, procedurally, I think backmasking and LMA is probably as far as I would go. Maybe not even LMA, but backmasking is really useful. LMA is pretty, like, placing a laryngeal mask airway is really easy, though. I feel like that's something that somebody should be able to, like, at least kind of half-ass and figure out, even in, like, a clinic setting. You start anesthesia Monday. Oh, dude, if you need some pointers for your anesthesia rotation, I can hook you up with that. I can absolutely hook you up with that. Spinal immobilization clinic today, because that's a good thing to know. So what I teach all my students is be a Hans device. So do you guys know what a Hans device is? Anyone? So I'll show you. This is a Hans device. So this is what, like, professional racers use. So basically, like, these parts go over your shoulders. So here, this is a better view. So these go over your shoulders, and this goes behind your head. So the idea is that it makes your torso and your head and your neck move as a unit, right? So what you want to do when you are stabilizing someone's C-spine is you want your forearms next to their head, like you have your, like, this part of your arm, like, next to the cradling their head. You have your thumbs over their shoulders, and then your hands behind them. So you kind of go like this. You have them like this. And so their head can't move, their torso can't move independently of their neck and head. So, like, anywhere that, you know, a part of them goes, you go too. So, like, when you're intubating them, like, you keep your head, their head in line that way, because basically their head can't move if you squeeze them that way. So That is a super important skill to have. Your dad wants to give you boot camp. Is your dad an anesthesiologist? That's awesome. C-collar, backboards, log rolls. Yeah, those are all useful things. I remember the family medicine shelf being deceptively difficult. I remember that being one of the hardest ones, honestly. It just like covered all sorts of crazy shit. Like it was all over the place. Like even internal medicine I thought was a lot more focused. But family practice was just like, you know, anything goes basically. Eight weeks of family medicine, that's a lot of family medicine. Mine was 1 month. I enjoyed my family rotation a lot, actually. I feel like that's a really good rotation for a student because it is so generalist. And I did it in like a pretty rural place, so I got to do a lot of stuff. And they did some like work in the ER, so I went and did emergency medicine stuff. That was fun for me. So I actually liked my family practice rotation. I thought that was really useful. I didn't want to do family practice, but I liked the fact that I got to like actually learn all, you know, like learn by doing all of the things that, you know, where I'd been learning on boards and shit. It's just step one. Yeah, I mean the family, yeah. Pretty much, yep. Yeah, the family shelf is pretty much just step one. 4 weeks of EM or peds? Oh, that's cool. See, we had to do 8 weeks of pediatrics, and I could have done without that for sure. Pediatrics was one of my least favorite rotations. I felt like it was both very toxic and like overly saccharine. I think that may have been maybe a product of the attending that I had. Like she liked to do something called patient-centered rounds, where basically you would have like the patient's family come out and like listen to you present the patients, which I thought was like super counterproductive because most of the people there are like, you know, have no medical education. So you're saying all these things about their like catastrophically sick kids, and they're like looking around like, what's that mean? What's that mean? And, you know, they have all these like questions that, you know, deserve answers for sure, but like, why are we generating those questions in the first place? Like, why don't we talk about the medicine? Why don't we be the professionals that we are and discuss these things, come up with a plan, and then go talk to them? You know, and then if they have questions about what we're gonna do, then we can answer that. But nope, we had to do it the hard way, and, you know, involve everybody. It's just like this ridiculous hand-holdy bullshit that adds time and stress to an already really difficult situation. Family practice wants you to present to her with a patient in the room. Yeah, I don't know. I think that's not a good thing for learners to do, quite frankly. Like residents, yeah, okay, but like for med students, I don't get it. Like the whole point is for you to learn how to present something, right? So if you're not a very good presenter and you're just kind of like rambling through like all this random shit, you're gonna sound like an idiot. Then it's really hard to, you know, claw back from that basically. And then if the patient starts asking questions and the attending's like, well, I don't know, why is that? And like, look at you, you know? I don't know, I hate that shit. What's the point of med students doing call? I do not know. I have no idea. I would never do that. So with all of that in mind, I say all that, but I am kind of the guy who throws my AA students into the fire. Like, you know, there'll be like a crashing patient in the ICU who needs a central line. I'm like, okay, hey, you're doing that central line. By the way, how many lines have you done? Oh, 2? Okay, that's fine. I'll walk you through it. Let's go. You know, or I'll just like, and I deliberately ask them questions that they're not going to know the answers to. And the whole idea is that you just like think about it, you know, and I don't care if they say something ridiculous or not. Like, honestly, they probably feel like I do, they probably feel a lot of pressure to like answer correctly, but really I just want them to, you know, say something that makes sense. I'm like, sure, I see where you're thinking there. And then we talk about it. An intercavernosal line. Nice. Dick lines. Let's go. Is it okay to say I don't know? Yeah, absolutely. So if you say I don't know, then I give you another piece of the puzzle and you get to think again. That's the trick. But it's not like toxic, you know, I'm not there to like bust someone's balls. I mean, I guess I am busting their balls, but it's not like you know, I'm not there to like grind them to dust and then tell everybody about how they failed. You know, I'm there to like make them think about this situation, like this real life situation. I don't just sit there and ask people questions, you know, at random. Like I'll ask them about the case that we're doing, you know, so that we're all on the same page and they understand like why we're doing things that we're doing. OB was your only rotation with 24s. It was a waste of time. Yeah, we did overnights on OB. We had a week of, what did we do? A week of days in OB, like 12-hour days. A week of nights, 12-hour nights. And then, what was the other week? Can't remember what the other week was. But yeah, it was, I don't know. I'll just say it. I hated my OB rotation. Sorry for those of you going into it soon. I thought it was terrible. I would quit medicine before I would do OB. 100% would quit medicine. I think it's an awful specialty, and it's one of the few that gets worse as you, or often gets worse after you graduate residency. Like if you're the type who wants to like care for your own patients, like whether you're on call or not, then you are fucked. Like you are like literally always on call. So don't do that. I strongly recommend against that. Pretending Aster to draw the structure of cholesterol? Like, why? What good would that possibly do? I mean, was he just fucking with her, or was he actually like, you need to know this? Like, why does that matter? See, I hate questions like that. But yeah, I'll ask my AA students, like, first year AA students, I'll ask them shit that's like on the anesthesia oral boards. You know, I'll ask them stuff there's like no way they know the answer to. And just so we can talk about it, you know, so they feel the pressure and they're like, oh shit, maybe I should know that. It's like somebody else is gonna ask me that. We'll send you the schedule when we get here, and they said you're staying for 24. Nice. Perfect. Perfect. Surprise, you're gonna be here for an entire day. Oh, and since you're a student, you don't have a meal pass. Suck it. Yeah, that's bullshit, man. God, med school is just such a screw job. But hey, it gets worse in residency. Isn't that awesome? Your school limits weekly hours? What? Like, I think ours made us go home, quote, made us go home by 7 every day, but they didn't limit amount of hours. Yeah, we didn't have a call room. So our call room, the medicine call room, the med student call room in OB was a closet. It was literally a closet that they just like took all of the stuff out and put this like tiny, they put a, you know, the like obese person chairs, the like extra wide chairs. They put one of those in there and called it a love seat. And so there were 3 of us in this literal closet with a chair and the world's smallest love seat. And we were just expected to stay there. So you guys have the residency hours restriction? That sucks. That sucks really bad. Yeah, we have, so I've told this, I know I've told this story before because it's freaking ridiculous. But we had, so this closet that I mentioned, obese chairs sound super comfy. If you're the only one in it, if there's somebody else in it, it is much less comfy. because it's kind of designed for like 1.5 people, you know, not 2. So the OB coordinator, like the secretary, who, you know, like did all our scheduling and stuff, for the OB rotation. Everybody, her nickname was the Riddler because she would send out emails that had just like random punctuation throughout the sentences. She just like put question marks in inappropriate places, like in the middle of sentences and shit. I don't know why. But anyway, her nickname was the Riddler, and we had these things like these little walkie-talkies, these Vocera walkie-talkies on OB, and that's how they communicated that like somebody was delivering. But our closet, the med student closet, was really far away from like the nursing station. So we couldn't, you know, we would either like have to sit out there where none of our, like we didn't have access to a computer out there because they specifically told us not to use the computers at the nursing station. Because other people needed them, I guess. But anyway, so we didn't have access to any patient information. But, you know, so we had to like go back to our room to have the computer. That it was a fucked up thing. But anyway, I asked the Riddler if we could have a Vocera, like a walkie-talkie for the students. And she was like, oh, no, we can't. Like, I was like, because there's an extra one, like, on the docking station. You know, there's, like, a couple extra ones. So can we just, like, have one of those be the med student walkie-talkie? She goes, oh, no. Those cost, like, $10,000 a piece. I'm like, what? Like, what? You expect me to believe that this fucking walkie-talkie costs $10,000? And so, me, being the smartass that I am, pulls out my smartphone, and I was like, this is $500. It accesses the internet. It has a color screen. It has a touch screen. Like, it does lots of things that the Vocera does not do, and it's $500. So clearly, what you're telling me is complete bullshit. So like, maybe we can just turn this on. Like, we don't even have to like use it. We just have to have it there and on so we can hear things that go on through it. Your Tending would fall asleep mid-sentence and then keep talking 3 minutes later. Oh my god. Was she narcoleptic? See ya. Wow, you get reception into your handheld radios from across the city. Jesus Christ. Not bad. Got your money's worth on those. Yes. She never slept. Forced narcolepsy. Actual Motorola radios. All right then. Very fancy. What the fuck was I doing? Oh yeah, I have to go back here. Wait, did I get the? No. It's HCA. They have money. They do have money. They don't give it to their employees though. But they definitely have money. There it is. Yeah, HCAs are brutal, man. First day, the chief resident pointed at the wall with heart tracings and said, look at the wall. You'll know when something is happening. Perfect. Thanks, senior resident. Thanks for the info. Upgrading Meditech? What? HCAs use Meditech? Jesus Christ. No thank you. Meditech is terrible. Damn. Super glad, like, our... we use Sunrise, among other things, but that's still not Meditech. It's way better than that. Yeah, we've definitely done the Pennywise Pound Foolish thing, especially since Cerner's headquarters is here. Well, was here. Now it's Oracle, but you know what I mean. The headquarters of a major EMR is here in Kansas City, and we don't use it because reasons. You give me 40 incidences of this happening. Jesus. That sounds like something like truly wrong with her. I mean, it sounds like narcolepsy, honestly. Oh my god, that thing is so tanky. Jesus Christ, would you please die? There we go. Oh, nap. Worst rotation of all time. Yeah, I mean, I pretty much agree, honestly. I thought OB was utter dog shit. I hated it. Nope, that's not what I want. I want this. Taking your meds on the first day and your breathing is distracting. You know what that reminds me of? We're gonna watch some John and Kate +8, guys. We're gonna do it. Speaking of psycho bitches, ad block has been updated. Well, that's super exciting. I don't know why this defaults to that. Let's see. John, Kate, breathing. This is amazing. All right, pause.
She was probably, I'm sorry, can you stop breathing so loud, honey? He's like, breathe quietly. So I consider them sick, anyone sick, for, do you hear yourself breathing? Oh, that's just gross. Does anyone hear him breathing?
I'm sorry for breathing.
Can you imagine that they got divorced?
I'm sorry, can you stop breathing so loud, honey? He's like,
I mean, that's fucking awesome, right? Is Kate your attending? Oh shit. Yeah, her Karen haircut is classic, right? It's super appropriate. They're so in love, obviously. Dude, like, I can't say I watch this show very often, but from what I remember, like, he seemed like a pretty normal dude, and she's just like a fucking bitch. She's just like a psycho, hardcore bitch. And this is like typical behavior. Can you stop breathing so loud? Okay. I felt the romance in the air. Yeah. Alright, so while we're here, we're gonna watch something real fucked up. You guys ready? So if you guys haven't, uncanny how similar this was, yeah, right? Yeah, I don't know, like, how do you procreate with somebody who's that mean? Like, dude, get out. Yeah, so if you guys don't follow football, you're about to, hurl a lot. Let's see. No replay shown? Oh. Here we go.
Good things here in this game. Here's Chubb trying to pick his way inside the 5, and he does. Knocked down at the 3. Ball came out, but he was down. Minka.
Come on now. Yep. Yep. Look at that. Let's see if we can get a better angle. Is this Chubb? Yes, this is absolutely Chubb. We're going to get a better...
The knee injury was quickly ruled out with something that looked so significant that they didn't even want to show the replay in slow motion.
Oh god! Oh god!
On TV, but in this video we'll take a look at what we can maybe learn
Oh,
about
it's
the
so
scenario
bad.
and just what we saw in the full speed play.
Go on Twitter. Best fit it's on Twitter. Okay. I think you mean X, actually. Thank you. I haven't been on Twitter for a while. Let's see. Nick Chubb. Oh, I guess I should be more... Oh, there we go. Hey, look at that. Whoa, that's so bad. Yee. Oh, God. makes me freaking cringe. It gives me, like... Look at that. Oh, God. Oh, God. Oh, so bad. Oh, God. Watching injuries like that is just excruciating, dude. Elon still had the rights to X.com when he sold PayPal? Really? That's interesting. I wondered why he chose to do that. It's kind of interesting. Yeah, secondhand ouch, absolutely. Yeah, that is all sorts of ouch. All over the place. I feel for that dude. I mean, his career's probably over. No lie. Like, the way that knee stretched, I'm actually pretty surprised he didn't have, like, a vascular injury or, like, a nerve injury. I mean, he may have, I guess. But, like, that's... Your knee is obviously not designed to bend that way. I'm sure he tore, like, fucking everything in his knee. Yeah, I actually was not watching that game live. I turned on the what do you call it, like the post-game report, and they were like, Nick Chubb's injury, and then somebody mentioned it the following morning, like Tuesday morning, and I was like, well, shit, now I have to watch it. I have to watch this. And I did, and I had the same reaction then as I did now, basically. But yeah, all those ligaments, man. I'm sure his entire knee is just shredded. I don't even know how you go about repairing that. I mean, I guess the same way as you would each individual ligament, but I don't know. I mean, that is just a absolutely heinous injury. It's a shame too, man. He's, you know, he's one of the better running backs in the league. It sucks. Ah! I'm being quicksanded. Whole knee just yoinked. Oh, yeah. Yeah, I mean, it's just like, it's just gone. Like, his teammate's trying to help him up, and he's like, nah. Nope. That ain't happening. Yeah, that's one of the few things that still grosses me out. Like, nastiness with eyes and, like, gruesome orthopedic injuries are, like, I killed Shikari. I did. Thank you for the skill point. Your tending said tibial plateau fracture is likely. Yeah, I've heard that. He could lose the leg with something like that? Whoa. Yeah, I mean, if he has a substantial, like, neurovascular problem, then yeah, for sure. Yeah, I mean, there's big freaking arteries going through your leg there, especially in those guys, man. Oh. Gotta get the music back on. Forgot about that. I was like, it seems very quiet. There we go. Yeah, it would not surprise me if, you know, he had, like, some real serious, like, danger going on. You know, like Alex Smith type shit. In case you don't know what happened to Alex Smith, he had a vascular injury with, like, I think, I can't remember if his was a surgical complication or if it was actually an injury. But yeah, he had his knee repaired and, like, had, like, infection problems and all sorts of crazy shit as a result of vascular damage. Because he just, like, wasn't perfusing his muscles. But yeah, I could totally see that happening to Chubb. Like, you know, you tear out some, like, feeder vessels and shit, and, like, your muscles don't get the blood flow they need, and you're just done. There's not much recourse for that. Open globe injuries? Yes, open globe injuries are not cool. Not cool at all. And what's really bad is when they, like, you know, something changes and they start, like, squishing the contents of their eye out through the injury. That's pretty fucked up. The leg could have come off. I mean, it probably was pretty close to that, frankly. Because, I mean, what's holding that on there? Just his skin, probably. And muscles. Muscular attachments. Yeah, that was a super bad injury. That might be the worst. I don't know. Dak Prescott's injury was pretty freaking bad. But I was gonna say that's certainly one of the worst injuries I've ever watched. His leg needs an emotional support dog. That's great. It's so true. It's okay, leg. We'll get through this. Yeah, that was some hardcore shit, man. I mean, I think that's part of, that's part of why running backs are not valued these days, right? Because it's such a brutal game that they just get hurt all the freaking time. I mean, look at Saquon Barkley. That guy could have been a superstar, but he just gets his ass torn constantly. He's just perpetually hurt. Because you're running into 300-pound muscle walls all game and expecting that to, like, not hurt you somehow. But yeah, on that note, like, football is just becoming, like, fucking dangerous, dude. Like, injury has sort of always been part of the game, but I mean, these days people are just, like, getting totally wrecked, you know, between all the, like, chronic traumatic encephalopathy and, you know, just these serious ass injuries that end careers. It's, you know, like, look at Andrew Luck, you know, fucked his neck up and he's like, nope, I'm done, I'm leaving. Homie can't even stand up for himself. But breathing skills lab in title? Yeah, you can do that. Another interesting one would be to provide CPAP. Like, most people don't know what CPAP feels like. So like having a like either a CPAP machine available or like if you have an anesthesia machine or something that you can like close the pop-off valve. So you at least have kind of an idea, like, what people say when they can't, like, tolerate their CPAP machine. I think that'd be kind of cool. Getting an RT to come talk? Oh, that's a great idea, actually. I don't know why I didn't think of that. That's a really good idea. Yeah, RT would be all about that. Oh, you know what you could do? You could do, different types of airways. I can't remember what was in your list previously, but like nasal airways, oral airways. What else? Like in addition to the LMA and bag mask and all that. You could also do different kinds of masks, like nasal cannula, non-rebreathers. Like what is Airvo, the like high flow nasal cannula, which I think is kind of a ridiculous idea. It's so if for those of you who don't know what an Airvo is, it's like this thing. It's like a big nasal cannula that goes like, you strap it over your face and it covers your nostrils. And supposedly you can put like 100 liters per minute of oxygen through it, which is just stupid. Like, don't do that. They advertise it as like the benefit is you can eat with it on, but I guarantee you if you've got 100 liters of oxygen going through your nose, you're not going to be eating with that. You probably don't feel like eating either, frankly, if you need that much. So a typical nasal cannula, even at like 15 liters, which is generally the max that like makes any difference, is like 40% oxygen, basically, like an FiO2 40 at most. Supposedly the Airvo can get up to like 60, but then just like put them on a freaking CPAP or a BiPAP. Like, I don't know. I don't get it. Yeah, high flow nasal cannula. That's when I first saw it was COVID. But like, dude, just, I mean, if they're there already, like, don't use 100 liters per minute of oxygen. Like, you're gonna run the hospital out of oxygen. It's ridiculous. Just put them on a BiPAP. The Air Q3 is supposed to be a better eye gel. I have not, actually. I haven't experimented too much with different types of LMOs. I like the eye gels though. They're nice. Only heard it used for cluster headache. Yeah, I mean, there's a lot of people, at least at our hospital, using it as like a, you know, sort of modified rescue device, and I think that's super dumb. Like, it's not gonna work. Feel like you would sleep so much better, dude. Like seriously, get a sleep study. If you feel like you sleep poorly, like if you snore, get a sleep study done. Like I have sleep apnea, and I've only missed. Like, let's see, what did I do? I think I left my CPAP at work one day when I was on call, and I had to sleep without it, and like I woke up with like the driest mouth ever, and I woke up like 4 times during the night. So like my sleep apnea is not bad. I like barely qualified and basically like leveraged the fact that my sleep medicine doctor was somebody I did residency with to get a CPAP. Because I was like, it's not going to get any better. Like my neck will not get less fat as I age. So why don't we just line this up now and take care of it? An oxidizer. The hell is an oxidizer? See, I gotta look that up. Oh my god, there's a fucking Gumpy knee. Oxidizer. Don't know what that is. I still don't know what that is. I don't think I've ever seen this. Nasal cannula with a little reservoir. Okay, fair enough. Sleep with your mouth open, but sleep so well. How do you not, like, dry out your mouth? I feel like the air is... Oh, Jesus, those are expensive. Wow. 25 bucks a shot, huh? Holy shit. Man. I love how it's called the Chad Oxidizer. Hilarious. Miami J collars 100 each. Jeez. A Chad and yeah, why not? Yeah, you gotta humidify the air, man. Humidified air is the way to go. Whether you're, you know, using a respiratory device or not. Keep your house humidified. I've got a humidifier on my, well, one of my HVAC things. Because my house is so big, I need 2 HVAC units. I'm so cool. But we actually can't install one on the 3rd floor because it'd freeze. Because it's like basically in the attic. Chad's too fast. Oxidizer. Oh my god, there's so much shit attacking me. Does a humidifier increase bacteria in the air? Are there airborne bacteria? I don't think so. Yeah, and it might in carpets, yeah. I mean, if you, yeah, and like cloth surfaces. That makes sense. But I mean, I'm not talking about, you know, 90% humidity in your house. I'm saying like 50. And for me, I've got a really old house with like lots of old ass lumber that absorbs water like crazy. So it's actually pretty tough to get there unless it's like crazy soupy outside. But we just leave it on. I just leave. You're supposed to turn your humidifier off in the summer. I just leave it on all the time. And it like never gets above 60% in here. Usually never gets above like mid 40s. Oh yeah, the like local humidifiers, the small ones are they're cool, but they like you have to refill them all the freaking time. They're a huge pain in the ass. We have a couple of those for my kid because he's got asthma. So like when he gets a URI or something, he's like, you know, coughs and hacks a bunch. And like I said, we can't, like our 2nd and 3rd floors are not humidified. So it gets really dry during the winter up here. But not for me, because I have my humidified CPAP. Yay! I have a medical condition, and it helps. Whee! You heard about those when shadowing peds? Yeah, I mean, they're nice to have. They're not very expensive. I think they're like 40 bucks or something. And they hold a lot of water. Like, you have to refill them every, like, 2 to 3 days, I think. even of continuous use, that is. How would you explain sleep apnea to a 5-year-old? You have lots of tissue in the back of your throat that when you suck down on it, it collapses. So it's kind of like sucking super hard on a straw. That's it. There you go. Sleep apnea for 5-year-olds. You fix it by blowing through the straw instead of sucking through it. That's right. Sucking is the problem. Blowing is the solution. You heard it here, folks. Non-pathologic central sleep apnea on one of your studies? How do you have non-pathologic central sleep apnea? Isn't that sort of like a pathology by definition? I mean, everybody has like apneic and hypopneic episodes, right? That's like a normal condition when your brain is in sleep mode. That's why you gotta have more than 5 per hour to qualify as having sleep apnea. And like my AHI was like 5.6 or something. So I was like, please just give me a CPAP anyway. When your neck is thicker than Gaston, your throat collapses when you sleep. I feel like I should break into song right now. Little Beauty and the Beast flashback. Yeah, my neck is giant, and I don't really know why. Like, I think my neck is like 17.5 inches, and that's basically like, if you have that, you have sleep apnea. It is a thick neck. I'm a thick boy. Thicker than Gaston. That is a quality pickup line. I might have to use that. Thick neck, that's me. Oh god, I should pay attention to the game when I'm fighting a boss. I'm so bad at this. Yeah, so, did I not tell you guys that, so my son actually had a phase of about, at least 6 months, probably more like a year, where he wore a, like, copy of Elsa's dress from Frozen. And he was like, she's got awesome ice magic, I want to wear a dress just like her. We're like, okay. Yeah, because like one day we asked him, we were like, why do you want to wear Elsa's dress? Because he never really like said why. You know, he's just like, I want to wear Elsa's dress. She's so cool. And then he was like, yeah, she's got this awesome ice magic. Like, all right, fair enough. That's cool. He's dressed like Gaston. No, he looks like Gaston though. He is ripped, man. My kid is strong as shit. I went with him and one of his friends, actually, who, like, to be honest, looks kind of scrawny. But I went with both of them to a climbing gym this weekend, and they just showed my ass up, man. Like, I didn't even climb with them for the first, like, half hour that we were there, and they were just, like, scaling these 30-foot walls like they were nothing. And so I got in. I probably climbed for like an hour, and they were there for like, they were going for an hour and a half, and I was just destroyed the next day. My shoulders, like I tried to open a door in the next morning, and my hand just instantly cramped. Like giant Charlie horse, and I was downstairs like, oh, ow, I'm such a bitch. It was bad. It was really bad. And meanwhile, they're just like, that was fun, let's go again today, yeah. Your parents used to ask you why you played Peach in Smash Brothers? Did you also enjoy her ice magic? Wait, Peach doesn't have ice magic. Shit! Oh shit, I'm totally missing so much Discord activity. So bad at this. Let's see. Take out the mask and attach it to an advanced stairway. Yes, you can! Yeah. Yeah, so you swap it over. They all have like, there's like a uniform attachment that works with ventilators, bag masks, anesthesia machines, all that shit. But yeah, honestly, I do kind of look forward to watching Disney stuff with my daughter. That'll be fun. She watches like, you know, these ridiculous, like Miss Rachel. Do you guys know what Miss Rachel is? Please tell me you don't know what Miss Rachel is. She basically just sings a bunch of children's songs. And it's better than what we watched with my son, for sure. It's like actually, you know, educational kind of. And we just exposed him to a bunch of stupid bullshit that was excruciating. It sucked for us. And this stuff I can at least like tune out. You know, it's not like the worst thing in the world. So, what level am I? Did I wear any of my fun stuff? I have this like whole suite of gear picked out. Ooh, I can wear that, but then I sacrifice a shitload of resistances. Maybe not. I'm Compressions Monkey. Yeah, you can be a tube monkey. Yeah, that's cool. Why would you know who Miss Rachel is? I don't know. Maybe you're a fucking freak who likes watching like women sing kids songs. I don't know. I don't judge you. Don't judge me. She's a speech pathologist? Is she? I thought she was like... I thought she had a music education. Well, let's fucking look it up. Miss Rachel. Here we go. We're going down this rabbit hole, guys. There we go. This picture pretty much sums up the entire, like, vibe of her thing, of her channel. Yeah, she is pretty, right? Let's see. Miss Rachel, here we go. Get larger. Let's see. She did theater. She earned her master's degree in music education. Worked as a music teacher. She's getting a second master's in early childhood education. Sweet. Her husband's a Broadway music director and composer. Okay. So her son had a speech delay. I don't think I've ever bothered to read this all the way through. So it was inspired by the techniques of her son's speech therapist. Got it. So I think our whole family is going to be Miss Rachel for Halloween, actually. Diversity and inclusion consultant. Now, what in the fuck does that mean? Is that a real job? Okay. Singer-songwriter Jules Hoffman. Friend once sent you a kid's alphabet song video on YouTube. Sounded like a really dope song. Nice. She's really nice outside of her. I mean, yeah, I think like my wife, I think follows her TikTok and says she sounds like a really like, you know, really like nice person, just genuinely like friendly. But I mean, if you're, you know, if you're an early childhood educator, like you're probably a saint. Honestly, like let's just be real. That is the worst job in the fucking world. And those people just like love kids. They just like legit love kids. Have I heard about this doc? Uh-oh. Let's see. I will follow that link very shortly. As soon as all these skeletons stop trying to ream me. There we go. You want to do peds? Oh, dude, don't do that to yourself. Do peds through another specialty. Let's see. Oh my good god. What is this freaking alphabet soup here? What the fuck? What is this? physician, entrepreneur, educator, motivational speaker. Cardio-nephrologist? Interventional cardio-nephrologist. Okay. He runs a private office in Jackson, Mississippi. Well, I guess he doesn't have any dearth of clients. I'm sure there's plenty of people with failing hearts and kidneys in Mississippi. From skipping forth. Is this real? Is this actually like a person? This is awesome. I hope this is real. Later uses younger brother to sickle cell disease while he was in med school. He had a car accident that almost claimed his life. Made it home that evening with bruises and cuts. To learn his brother died. Skipped 4th and 6th grades due to academic achievements. Okay. God, this is crazy. Child and adolescent psych. That's a good idea. Your dad wants you to do anesthesia. I mean, anesthesia is objectively is a very good choice right now. It's great pay with potentially really good lifestyle, depending on what you choose. But if you don't like it, don't do it. You know, it's not for everybody. It's a pretty hardcore job. Like, it's fairly chill most of the time, and then the times when it's not chill, it sucks real bad. There's some part where he drove off a bridge. In that moment, I decided that I wanted to quadruple specialize and move to Mississippi for some godforsaken reason. I want to have more education than the sum total of the people in the city I live in.
Just need a moment.
That is crazy. Some people are just built to train forever, I guess. A minister, a pastor? Of course he is. Why would he not be? Why not? Give me that silver coin. You know that guy's like, he has like, he sells children's heads out of his basement or something, you know, on the black market. There's something's up. Something's up. DO and MD, dude, what a waste of time. Chin surge, anesthesia, CT, anesthesia, and a couple masters. Yeah, I just don't understand that, man. Couldn't match in the 80s? Oh, interesting. I mean, still, dude. Like, couldn't you just find something else to do with your time? Instead of accruing 4 years of opportunity cost and debt? It seems like there's so many smarter ways to do that. Not to mention the multiple residencies thing. That's like, I can't even imagine going, like, voluntarily going back to residency. Ugh. Ugh. Terrible. Anything peds related is in shortage? Yeah. Yes. That is generally, I mean, I think pretty much everything is in shortage, but pediatrics is a very unattractive career path, to be quite frank. Yeah, as Uranus says, it's like just so undercompensated, it's ridiculous. And if you want to do peds, you can do it through another specialty. Like peds surgery, or peds anesthesia, or peds emergency medicine. And I know at least for like peds surgery, I think is really competitive, but peds anesthesia is not. I don't know about peds emergency. Oh, ouch. Ooh. I don't even know what killed me. He's his whole own SOR. Yeah, it's true. I've seen that with like the multiple training things with foreign grads a lot. Like a lot of times they don't do, you know, what they train to do because they have to come back and do residency in the US anyway. So they just change it up. Like I work with a dude who was actually an anesthesiologist in India, and he came back and did what did he do? He did plastics, but I think he did general surgery and then a plastics fellowship and also a craniofacial fellowship. So he did a lot of that sucks. He also he did a bunch of like peds, like cleft palate and that sort of stuff, like facial repairs in kids. Stop that. Are high heels acceptable in the hospital? Yeah, I don't know why you would want to do that to yourself, though. It sounds freaking awful, man. Like, the most comfortable shoes in the world are pretty bad once you're standing around for 8 hours on rounds. Brother wants to do anesthesia, but you don't want to be compared to him at all. Well, I mean, if you do it first, then I don't think you have... That's not a problem, right? Be like, bitch, I'm already an anesthesiologist. What? What do you want? Tape a fall risk side to your back. Seriously. Yeah, dude, wearing heels to round is, that does not sound like a good time. I think you would regret that decision very quickly. Okay, that's a good belt. Do I want to start using that? I guess I do. Let's do it. Let's put on my big boy gear as I can. And what's that, Grace? Okay. That's a lot more energy shield. Holy shit. Okay. Can I put anything else on? No, of course not. Bunyan speedrun. Hilarious. Studied for the MCAT for 5 days and got a 524. That's pretty good. That is pretty good. Why is he going into medicine? You can do way better doing something else. That's what I think about that. Get out of this career. Do something without a ceiling. That can't be real. Oh, it is. It's very real. Alright. Back to the quarry. Yeah, that's pretty crazy ass score on 5 days of studying, for sure. But for real, tell him to like go into tech, learn computers and shit. Like, do something that's not medicine. He'll be way better off. Binged every Khan Academy. Wow. That's some like Rain Man shit right there, man. That is impressive. Do something that won't shorten his lifespan. Yeah. Yeah, medicine is pretty tough road to hoe, man. I mean, he probably didn't take any practice tests, right? Yeah. Like if you're on a 5-day study plan, then you're not practicing. You don't give a shit. You're just going. I mean, probably both. Basics and cram skills. Oh, I need to go do my lab. Shit. I totally forgot about that. Yeah, I mean, if you can listen to those videos and, like, retain enough to do that well on the MCAT, that's pretty impressive. That's like a superhuman feat. His biology department award. Why not frame that, I guess? Proud parents. So are you the black sheep? They're just like, this other kid's also in medicine. He's alright, I guess. ChatGPT versus emergency medicine board questions? I mean, it probably did pretty well, right? Because a lot of those questions are sort of, you know, Googleable, basically. It's all pretty rote. Excellent. Yeah, I think the like AIs have been doing progressively better on those exams. Like as they you know, as time goes on, basically, and they upgrade the software. Yeah, well, I'm not saying it's perfect, but I mean, certainly a useful tool to have on your side. I don't think physicians are going anywhere anytime soon. But just the fact that it can come up with costochondritis from, you know, a constellation of symptoms is pretty good. It's pretty impressive. Oh. The Black Core. It fabricated studies. Yeah, that's... I love the fact that it just, like, makes shit up. ChatGPT just, like, makes up random-ass studies. I think that's just hilarious. Went to med school at 20 and applied with a 3.3 GPA. Hey, low GPA brother! I applied with a 3.1. I know all about that. It's lots of fun. Throwing your money into the void, hoping somebody gives you an interview. Yep, I did that. I had no idea what I was doing. I didn't decide I wanted to go to med school until like a month before the MCAT, basically. I didn't even know what the MCAT was until like 2 months before I took it. I had no idea what the fuck I was doing. At all. But I made it! He's got Marfans though. Yeah, take that. You get all the other advantages, but bitch, your aorta is gonna blow up. Hopefully not. Hopefully he doesn't have it that bad. Oh, there's always a catch though, right? Always a catch. Oh. Blind as fuck? Oh no. Had to get his lenses replaced. Wow. Yeah, Marfan's is a weird disorder. It's kind of interesting, like, how much stuff connective tissue affects. I mean, it kind of, like, makes... Oh, fuck. Kind of makes sense if you think about it. But, you know, until you're like, oh, yeah. I guess that does require, like, some sort of you know, suspension inside your body. That does have to, like, be connected to all these other things. Huh. Alright. Well, that sucks. I think my roommate in med school had Marfan's, actually. And he was just like, "Yeah, I have it. I don't care. I'm not getting evaluated for it." Mean frequency of correct responses is 83%. GPT-4 is 82%. Wow, so pretty much the same, right? Not bad. Not bad. Yeah, not copying and pasting the stats is probably a welcome omission. that's the gist of it. Gets the point across. It's cool. I think that's awesome. I'm not quite as scared of the AI takeover as a lot of people are. I think that'll be a nice tool for us to have. Marfan's running the family and skipped you? He's 6'4"? Well, oh shoot. I mean, Marfan's does be stretching people out. For sure. I don't know, I never had any aspirations to be tall. Sounds like it sort of sucks to be any taller than like 6'3" or 6'4", honestly. The world's not really built for you. I fit neatly in airplane seats without too much problem. Would I take Marfan's if it meant it became a genius? Well, I'm already a genius, so no. Gonna pass. I am also 5'9". Nice. Nice. Wow, the confidence. I'm totally bullshitting. In case that wasn't obvious. 6'4" white privilege and a genius. Yeah. What could be better? It's really the white privilege that that makes the package, though. that's the one that you've got to have. It connects all of the things together very nicely. Yeah. All right, bring it on, curses. Ouch. Family Christmas cards look like a checkerboard. Are your parents real tall? Yep, fuck. Oh, damn. I'm getting schooled. The chaos damage is rocking my world. I'll just scoot past that pack. How about that? Oh, does Dwadery do chaos damage? That could be a problem, so... Ruh-roh. Fuck. Mom just had Lynn's problem, but both your parents are real short. Oh no! So she has like all the bad parts of Marfan's, but none of the good ones. Bummer. Oh, so your brother like hardcore stands out then. That's interesting. Dare I say, cool. Maybe not cool for him. I don't know. Have the worst black people genes. Egyptians aren't good at anything. I don't know, man. They kind of built the pyramids, you know, like some of the most famous things in history. They're also really good at like inbreeding and loving cats and mummifying things. Historically, of course. Jews did that? Oh yeah, that's fair. I mean, the Egyptians at least made the plans though, right? And then forced the Jews to do it. Like, we totally want this awesome gravestone that's, you know, 1,000 feet high and weighs millions of pounds. Why don't you guys get on that? Can you guys go? Just take care of that real quick for me. Would I date a conservative? Yeah. Why not? All things in moderation, dude. You can be conservative without being a frickin' neo-Nazi. I mean, most people in America don't seem to think that these days, but you can. It is possible. I have a degradation kick. Hilarious. Yay, back to the black core. Yeah, I think Mitt Romney isn't going for re-election, right? For exactly that reason. He's like, everybody's just like so radicalized that he can't, like, his voting base is deteriorating. And he just like can't see the like direction for the Republican Party. Because he says he's too old? Interesting. I heard it differently, but I mean, that's probably part of it. He's certainly not any younger. I mean, the politics should be, like, I don't understand. We've talked about this on numerous occasions. I don't really want to get into political, you know, taking sides and shit, but like, why is our country run by 80-year-olds? You know, that does not make any sense to me. Like, maybe we should have some people who have, you know, like, yes, I understand that they're very experienced, but maybe some people who are a little more in touch with, you know, current generation and, like, what they want. Like, the people in government are supposed to be our representatives, right? I don't think I have a lot in common with most 80-year-olds. Can't drive, then you can't run the country. Well, I mean, shit, Mitch McConnell can't even get through a press conference like, before, you know, either like strokes out or his heart stops or whatever the fuck is going on. Like, dude, retire. Get out of office. And who's the other one that like went to the hospital? Dianne Feinstein? Isn't she like 94 or something? Like, what the fuck are you doing in Congress? A 100-year-old with dementia. Well, yeah, I mean, at least if somebody with demented like wouldn't cast a vote, that would probably be more useful. Like, at least if it's like people who are competent and care, and then like a few old people who are too demented to like understand what the hell's going on, then maybe we would actually get some progress achieved. A broken printer and a fax machine. Yeah, those debates were not great. That was really discouraging. I remember watching that and being like, oh my god, this is really, like, we have to choose between these people? Seriously? Hey, sail to Orioth. Healthcare policy? That's actually useful. I wish that med school had a little bit more practical application stuff like that. Promotion my channel? Viewers, followers, and views and chatbots? Oh boy! Oh, gotta trade something. Don't worry, I'll ban you in just a second. I'm not cool enough to have moderators. Go there. Go to my hideout. There we go. There it is. Thank you, sir. Boop. And banned. There we go. Sweet. You have ways to get involved with healthcare policy, but you don't take classes. I mean, that's good too, right? But it's nice to like have some sort of like formal education about it, I think. I think that's pretty important. Considering that's, you know, gonna shape your career for the next 30 plus years.
Who wins?
Patient safety certification? What is a patient safety certification? Is that like... That sounds like some made up bullshit to me. It sounds like it's not a thing. That's one of those like mini, you know, if you want to end up like this guy. Oh, who? Shit, where was that? The Dr. Alphabet Soup, man. This guy. If you want to end up like this, like where the nurses do, you know, where they just like put every single thing that they've ever done in their entire life behind their name. Yeah, get your patient safety certification. Because taking care of patients isn't something that everyone literally does all day long, every day. Some beef ribs? That sounds delicious. Where do you get beef ribs around you? There's a place like 5 or 6 blocks from my house that sells beef ribs, and they are delicious. Well, on that delicious note, I think I'm probably gonna go, y'all. Errors in the health system to developing QI and prevention programs? I mean, that's useful. You don't know if you do. I mean, there's gotta be something around you, right? There's plenty of barbecue out there. Alright, never mind. I gotta go. I gotta wake up early. Thank you guys for hanging out. I'm just not gonna do them. Yeah, fuck it, dude. Go to sleep. Have a good night. Take it easy, everybody. Thank you for joining me. Oh, man, it's been too long. I will do my best to be back on Sunday. I think things are maybe settling out a little bit, but anyway. Appreciate you chilling, and have a great rest of your week. I'm Milkman L. Take it easy.